This is FX Medicine. I'm Andrew Whitfield Cook, and we're here at the 2019 UIC Medical Cannabis Symposium, and we're speaking with Dedi Meiri. Dedi, how are you?
I'm fine, thank you. Pleasure
Dedi,
to be here.
you'll be speaking tomorrow, and I guess what you'll be talking about is disagreeing maybe a little bit with the common thing about it's a plant, so we should love it, sort of thing. Explain a little bit about what you mean by that.
Cannabis is a unique plant because it produces unique compounds, cannabinoids. And it's unique because our body produces the same compounds. So actually in the plant kingdom, cannabis is unique. But if you're going to animals, all animals except insects produce this compound. So we have in our body the endocannabinoid system. We produce these compounds. And this system is actually not it's controlling other systems. It's involved with other systems, balancing it and bringing it to homeostatic. Very moderate way, bringing other system, how we feel appetite, how we feel pain, the immune system. This system control it. When we're taking cannabis, it's changing this balance for good and for bad. And for that reason, it's a medicine. It's affecting our body. It's chemicals from the plant that entering into our body, secondary metabolites, we call them cannabinoids, also terpenes and flavonoids, that entering into our body, binding these receptors, sending us signals and changing this balance. So in the end, it's chemicals that entering into our body and changing the balance. When we have a problem with this balance, we have an autoimmune disease, and we want to bring this balance back. Cannabis is perfect. We're suffering from chronic pain. Cannabis is perfect to bring this balance. But we need to understand that it's chemicals that enter into our body and change this balance. Most of the drugs that we have today, the medicines that we have coming from plants, I don't see much difference. When I'm giving a talk and I'm showing that cannabis can affect cancer, have anti-cancer properties, people from the crowd always shouting, so why is to use chemotherapy if we can use plants? Taxol, which is the most severe chemotherapy, one of the leading, is from Taxus. Vincristine and Vinblastine from Vinca. So what do you mean? Like chemotherapy is coming from plants. We just don't know it. Aspirin, one of the most famous medicine, is this from exactly. So I don't see a big difference. I think the focus should be the patient and not the plant. I'm not advocate of this plant. Even though I have the biggest lab in the world that doing cannabis research, I'm not advocate. I want our patient as a person, as a society, to treat our patient better. So when a patient coming for a physician, and I'm teaching in the medical school, a physician is looking on this patient, need to examine and giving the best treatment he can. If cannabis is the best treatment, I think it's our duty as a society that the patient will get this treatment. But not always it's the best treatment. That it's putting in Facebook doesn't mean that that's what the physician needs to do. So does cannabis is the best treatment for pain? Probably not. But does it need to be one of the tools of the toolbox of the physician? I'm sure it is.
When you've got, let's say ketamine, morphine, whatever, antidepressants, Taxol, cisplatin, whatever, they're a single entity. They're a single molecule. Then you've got cannabis, which is not. How do you differentiate, and how do you propose that doctors should differentiate between the single molecule and the full spectrum drug? Or do you indeed say that you should have CBD or THC or whatever?
So first of all, not all the drugs today are single molecules. We have the Compaxone for multiple sclerosis, which is, I think, 9 different combinations of materials. We have a cocktail for AIDS. I'm talking about the famous one, but we have a lot of medicine which are not single molecules. It's few molecules that affect together as a symphony. Okay, and cannabis is part of that. It's not unusual in that aspect. And we still don't know which compounds affect which part. So increased appetite, do we need one compound or do we need 7? Do we need all the entourage of the plant? We don't know, but it might be that it's just few compounds. And the point is that because we don't know, and it's really helping in saving life, it's our duty to give it as it is.
So
But in the same time, I think it's our duty to learn as much as we can to distinguish what is doing what. So if you have a patient that suffers from chronic pain, but is very fat, we want to reduce his pain, but do we want to elevate his appetite? I'm not sure. So not all the effects of the cannabis as a whole is good.
Not favorable, yeah.
So it's better for us to learn how to treat our patient in a better way. Even if we are staying in the plant, which combination of compounds is good to which effect, which today we are gambling, we don't know.
Right. So do you therefore reserve cannabis as a sort of, second tier, third tier treatment and try all the normal guidelines first? And if they don't work, or if the patient doesn't respond well to treatment, will you go, look, it's worth a shot? Or do you say, look, the evidence shows us that there's a reasonable chance of it working, so I'll actually use that as a front line or a second line tier?
So yes, I don't think it should be, it could be the first line in indication that we don't have anything better than that.
Right.
So if in autistic kids, we know that 82% of the autistic kids responds very good to cannabis. It reduces anxiety, increases sleep, or reduce sleep disorder. It decrease violence. So it's very effective on these kids. So it should be the first line. And in other cases, it's not the first line. It shouldn't be, even though it's a plant.
Right.
Okay. I will give you one example. And this is a concept, and not for the example. In most of our systems in our body, we have a severe react and a moderate react.
Yep.
And the endocannabinoids, it's usually the moderate one. So if we are touching a hot glass, our hand will jump, and our hand will jump because in the tip of our fingers we have nerves with a sense of pain. They will feel the pain, send the signals to our brain that will send a signal to the muscles here and here to contract, and our hand will move. But from that moment, there is no reason to have the pain, and the body will reduce the pain slowly. And we all know, you get a heat, you feel the pain reducing slowly. This is the endocannabinoid system. A specific cell will send the specific endocannabinoid as a signal and reduce the pain. But if I'm cutting the finger now, the body is not messing up with the endocannabinoids, which will create opioids.
Yeah.
So the opioids are important and the endocannabinoids are important. We need to learn, as our body knows when to use which one, we as a physicians need to, I'm not a physician, but the physicians need to know where to treat which one. So if you have a severe attack of autoimmune, you probably need to give steroids to reduce the immune system totally. But if now you want to keep the balance of the autoimmune disease, cannabinoids can be perfect. So we need to learn where to use it, and it's a great tool to many diseases or reactions. And my belief that we need to take the time to learn how to do it. Meanwhile, it's our duty to give it to patients that really need it.
So you mentioned autistic kids. I guess there'd be a lot of concern over using that as a frontline therapy when we really don't know about long-term use. We've had some devastating effects with other medicines used that found long-term effects with suicide, things like that. More with ADD kids, but where are we heading with this research? Do you think we need to hold off on its use, or do you think, look, there's a real need now and it works, so use it because it's a plant? I'm trying to work this in with what you said about plants doesn't mean good.
Yeah.
Would you use it then in that sort of situation where it can really help with quality of life and the self-esteem and the interaction of that child now, and not wait to the long-term effects? Or do you think it's really important that we find out the long-term effects first?
So again, I think it's a duty of a physician, and it's true for every medicine, to know what are the risks and what is the benefit, and to do this calculation. When we're giving chemotherapy, it's not healthy. Okay.
Yeah.
But what are the other?
Controlled poisoning,
It's what you putting these two, the benefits and the loss, and you calculate if it's good and bad.
Yeah.
I think in cannabis it's the same. The physician or the caregiver need to think what he wants to do. Okay. With autistic kids, so the risk of giving cannabis to children, or at least what we are afraid of, because there is no good evidence even for that, is that it will be a problem in how you call it, not growing, in development.
Development, neurodevelopment.
Yeah. So the risk is that there will be inhibiting in development. But when you're talking about autistic kids that not speak, that they don't have eye contact, that there is very violent, what is the risk? There is no overdose, he won't die. So there is no risk here almost. It's just improving the quality of life. So again, depends. So now you're asking about ADHD or others, and this is more a accurate question, because here there is risk. With very severe autistic kids, there is almost no risk. But with the ADHD kids, there is a risk. If you're taking kids with 80 seizures a day, 20 seizures a day, with epilepsy, that the other medicine is not helping him, the risk of getting 20 seizures is more severe than the risk of will inhibit development. So it's always the risk in front of the benefit, and we need to calculate it. But it should be available. I'm not against cannabis, the opposite. But I think it should be available to the patient, but as a medicine, and with this calculation. So to say we need to grow it in our garden, I don't have any problem that people will grow whatever they want in their garden, but then I wouldn't consider it as a medicine. Okay?
Yeah.
So I don't. People said we know better how to treat ourselves. I don't see people going to the emergency room, said the physician, "Hey, move aside. I will treat myself. I know better." So why you think here you know? So it's somewhere we must find the balance between make it available to the patient and consider it as a medicine. So it's two different arms.
So with that in mind, you've got the Australian government dragging its feet. You've got supposed access through the SAS scheme, and yet we're seeing patients being driven to the illicit procurement of cannabis because they can't access readily an affordable product. Moreover, the doctors don't know what product to choose. So where do you suggest we go? What's your call for the Australian government and the legislators?
So again, I think it should be available to the patient under prescription, under control of physician, and I think we need to trust the physicians. You know, if you don't trust the physicians, there are worse drugs that they are handling, and we need to trust them. And the government, the Australian government, need to give this trust. So it should be available to the patient through the physician prescription. That's my belief, or what I think it should be in Israel. That the way it's working, it works quite well. And again, there is no reason, or it's not right to block a good treatment for a patient that suffers. It doesn't matter if he suffers from pain, epilepsy, nausea, I don't care. If he suffers, there is no reason to block a good treatment for him.
What's been the patient experience or the cultural experience even of the use of cannabis for medicinal reasons in Israel?
So Israel had a good approach, to my opinion, which it's very available to the patients, but it's not legal. It's not legal, and there is no legalization and stuff like that.
But they're not sanctioned.
No, so first of all, Israel is kind of social country.
Yeah.
So it's under healthcare. So it's not free, but you're paying a very low amount, like you're paying for all the medicine. So you're paying something, but consider to Australian money, I would say they're around $50, $60. It doesn't matter how much you get and what you get per month.
Yeah.
So it's available to the patient. It's under the control of the healthcare, the quality and everything. It's under a physician prescription, but it's available just as a patient. And there is a limited, and there is indication that you can get. So it's something in between. And as I said, it's under the control of the physician. And I think it's right. But what's happened in Israel, because we're treating from 2007, 2008, it changed all the set of mind of all the population, for all the people. Because everyone in Israel knows somebody that suffer for many, many years from something and now getting cannabis and being improved.
Right.
So it's your neighbor with the epilepsy, that you see him getting epilepsy seizures for years, and now he's seizure free or much better. It's your grandma that suffer from cancer and getting chemotherapy, and the cannabis really helped her to deal with it. It's people that you know that they are not stoners, you don't even suspect, and it's really helped them.
Yeah.
So I'll give you an example. My brother suffered from Crohn's disease for many years. Every 3 to 4 months he was hospitalized for a few days. In the last years, he was just before have a surgery to cut his intestine because he tried everything, and they started to treat with cannabis with him. And in the last 3 years, he's not suffering. He didn't have any Crohn attack. He's not suffering. So think about my mother and my father, 80 years old, but how it changed their concept. Their child is suffering from many years from a very severe disease. Every 3-4 months going to the hospital, you're sitting with him and everything, and now for 3 years is much better. So it changed the concept. It doesn't matter. They don't see it as a drug or as a stoners or something like that. This is helping their son.
Yeah.
So it's literally changing the concept of many, many, many people. And as time passes, more people are approaching that, see these kind of things, and it totally changed the concept in Israel. That is much, much more preferable.
We can only hope that happens sooner rather than later in Australia. Dedi Meiri, thank you so much for
Thank you
joining
very
us on
much.
FX Medicine today. And this is FX Medicine. I'm Andrew Whitfield.